Provided the update at 11 a.m. There were a dozen cases overnight in New South Wales, and the testing rates went back up to over 22,000 people being tested. So I'm deeply grateful for everybody who's come forward to get tested. It is so important for us during this stage of the pandemic to maintain high rates of testing, and Dr. Kerry Chant will reiterate that message in her advice to certain communities whom we would like to encourage to have greater levels of testing at this time. As we've been saying for some weeks, New South Wales is at a critical stage in this pandemic, as is evidenced by, unfortunately, the worsening news that was received from Victoria today. In view of the health advice, in view of the escalating situation in Victoria, the New South Wales Government today has decided, based on the evolving health situation and the health advice, to ensure and require that every returning traveller from Victoria is in the mandatory 14-day hotel quarantine when they get to Sydney Airport. We are also mandating that no one can come to New South Wales outside of those border communities that's defined in the public health orders, but for Sydney Airport. We don't want to see multiple places where returning travellers are coming. And we also feel, given the evolving situation in Victoria has been going on for some weeks, that people do that at their own expense. There should be no difference from a New South Wales citizen coming back from an overseas destination in terms of the cost they're having to pay versus the cost of returning travellers from Victoria. Of course, there are always exceptions to hardship if people can't afford to pay, but we will consider those. But as we've been anticipating, we anticipate that the further lockdown in both Greater Melbourne and regional Victoria will assist us in the numbers we're dealing with. In the last 7-day stats that I received, the vast majority of people that are coming through Sydney Airport from Victoria are on forward travellers that are going either interstate or overseas. But for those who are coming or returning home from Victoria from Friday morning, so from midnight Friday or Friday morning for convenience, any flights having those people will ensure that all returning travellers do that mandatory 14-day quarantine. I can also advise the community that New South Wales will also make it more difficult to come to Sydney if you're a Victorian based on your critical service requirement, or if there's a current provision which allows certain categories of people to come from Victoria to New South Wales, and we are reviewing and look to tightening some of those definitions to make sure only those with absolutely necessary requirements. And of course, the death of an immediate family member would be an example of a situation where we would allow, obviously, people to continue coming in to New South Wales. The numbers have been quite low in the last 7 days and quite manageable, and I want to thank Health for maintaining that rigour. We've had incredibly rigorous practices, as you all know, and I want to thank the Health and the police authorities for their role in that. But obviously, given the escalating situation in Victoria, and also the fact that we are on high alert, and whilst the number of cases in New South Wales is pleasingly stable, we continue to be at high risk, because we know how 1 or 2 cases that get out of control can have a detrimental impact and can require us to do that contact tracing for a prolonged period of time just from one incident. And we're trying to ensure that we reduce the risk on all aspects in dealing with the pandemic, and obviously dealing with those return travellers is one of those risks. I've now asked Dr. Chant to give us any updated advice, especially in relation to testing, and then Minister Hazzard will make a few comments, and then obviously we'll take questions.
Thank you, Premier. So we had experienced 12 cases overnight to 8 p.m, and that was reported this morning. Clearly, we're most concerned about unlinked cases, and we continue to have a couple of those cases that we've experienced over the last few days, and that highlights the need for the community to continue to come forward. The areas that I'm particularly urging the community to come forward is in southwestern Sydney and western Sydney, the LGAs of Cumberland, Parramatta, Fairfield, Bankstown, Liverpool, and Campbelltown. It's essential that we have high rates of testing across the state But I would urge the communities in those local government areas to particularly, with the most minimal of symptoms, please come forward and get tested. It is essential that we find any as yet undetected chains of transmission and break them. The earlier we can find a chain of transmission, the earlier we can stop it. And I'd like to thank the community for turning out into such high numbers. But I'm actually asking you to redouble your efforts over the coming days to weeks so that we can be very confident that we have got containment of that cluster in that area. Thank you.